Both proximal and distal wrist joints are ellipsoid-type synovial joints. That means they move along two axes. So what does it actually mean? It means that our wrist joint allows four different movements that are flexion, extension, adduction, and abduction. Let's have some better understanding of these four wrist movements. Moving our fingers towards the forearm, we call this posture as flexion because we are moving our hand towards the forearm. Now, when we move it in the opposite direction, that is, moving our fingers away from the forearm, we call this posture as extension. Why? Because we are extending our hand. So now remember that this posture is known as flexion of the hand, while moving it in the opposite direction, we call it extension of the hand. Coming to another set of movements at our wrist joint, let's recall abduction and adduction. Now, when we move our fingers towards the ulnar side, we call it ulnar deviation or adduction. And at the same time, when we move our hand in the opposite direction, that is towards the radius, we call it radial deviation or abduction. Now let's not forget that moving your hand towards the body, which is at this side, we call it adduction as we are adding to the body. And moving it to the opposite direction, which is away from the body, we call it abduction because we are moving our hand away from the body. Let me tell you one very important thing. It is that the abduction movement or the radial deviation movement is quite limited. Why? Because of its connection between the tubercle of scaphoid bone against the radial styloid process. So let's recall these movements: flexion, extension, adduction, and abduction. Now let's not forget that these movements of joints are not at all possible without the presence of muscles. So it's quite important to discuss the various muscles acting on your wrist joint. We'll move towards the next section to discuss the muscles.